Well, welcome back, everybody. If there's anybody by the back doors, could you just wave people in so that they know? Thank you, Peggy. Lasso them in. Yeah, there's a few more. So after a very stimulating morning, I hope you all enjoyed your lunch, had a chance to sort of refresh, and now for the home stretch this afternoon. Starting off this afternoon, we're going to have, we're honored to have a great panel that is going to be talking about challenges, impact, and lessons learned in global budgeting arrangements. So this morning we were talking about fee-for-service and ACOs, and this is going to be a different take on how the organizations that these representatives work in are doing game-changing things in this area within their context. So our moderator for this panel is Cheryl Phillips, Dr. Cheryl Phillips. She's president and CEO of the Snp Alliance. And we're so glad that you could be with us today to help lead this panel, and I will turn it over to you.
Thank you, Mark. Yes, hi, I am honored and delighted to be here. And if I seem a little bit aloof to people, I'm recovering from a very rapid onset GI bug, so everybody gets elbow bumps and I'm not touching anything. So if I seem a little less than animated, that's my excuse. But what an important afternoon to be here. What an important day. And a little bit about, well, me, I'm a geriatric physician, so I've spent my career in integrated systems, predominantly in Northern California. Was also very involved, was the original chief medical officer of Monlock, the originator of the PACE program, for those of you that are familiar with that. And as I think about the opportunity, sort of setting the stage for the conversation that we're gonna have, I don't need to put up slides about how much the cost burden is borne by those with serious illness and multiple comorbid chronic. We know that. We know that. And we know that, and we've been struggling with solutions. And we also know that strictly the volume-based fee-for-service, not that there's everything all bad about that, but the volume-based fee-for-service model hasn't worked well for those with complex care needs. And so we've started to look to global financing structures. One of the new approaches, and I don't know if any of you are even familiar with special needs plans. They're a form of specialized Medicare and Medicaid managed care that targets high-risk, high-cost, vulnerable populations, whether they be those that are dually eligible for Medicare and Medicaid, those that are at an institutional level of care, long-term institutional level of care as deemed by the state, or those that have serious chronic health issues. So these are managed care programs that align policy, payment, and practice to serve high-risk, high needs. And there's, in your booklet, I included something on the special needs plans. But the reason why I bring this up, some of you who may have been in practice back in the ancient days with me, back in the 80s and 90s, managed care was sort of the dirty word, and it was neither of those things. It was often rarely managed and had less to do with care. But what we're seeing in this new emergence about looking at global payment strategies is truly being able to target those that have high cost, high risk needs. And so I'm incredibly excited because each one of these models of care are not about the old managed care. Remember the stories of we avoid adverse selection by having enrollment up on the third floor with no elevators. And you know, all of the gate blocks that were to services. That's not what we're talking about. And these global payment models, the ability to truly, as I pointed out early, the alignment of policy, practice, and payment in delivery design is what works best for those with serious illness. And so we're going to look at some very innovative models that in fact rely on the infrastructure of a global payment. So what I'm going to do is introduce all of our panelists. They're going to go through each one of their discussions. The summaries of their programs are in the book, so we are not going to go over their programs, but they're really going to focus on the application for high-risk populations and some of the challenges and opportunities. And then we're going to spend the last 20 minutes or so in interaction with all of you, because to me, it's the shared learning of how do we get past the challenges and how do we actually replicate some of these models in the environments where we all practice. So with that, I'm going to jump right in and do the introductions. So coming from Southern California, Kaiser Permanente, we have a dyad, a duet, if you will. Our two presenters, Dr. Susan Elizabeth Wang, who is the regional lead for shared decision-making and advanced care planning at Southern California Permanente. And she created and directs the Los Angeles Hospice and Palliative Care Medicine Fellowship. She's the chief of the Department of West Los Angeles Geriatrics and Palliative Care. She is triple boarded in internal medicine, geriatric medicine, and palliative medicine, and joined Kaiser from her prior role as clinical faculty at UCLA in 2006. And I'm going to be fairly brief with the intros because you guys can read just as well as I can. Annette Arekalian, I just butchered that. I should have asked you that for sure before. PharmD, and she is the executive director of Medicare strategy and care delivery for Kaiser Permanente. She provides in this role strategic direction for the 4.2 million members in the Southern California region. She is a certified professional of healthcare quality as well as an experienced pharmacist, and has had phenomenal organizational experience in strategy and planning and truly looking at solutions for the populations that we'll be talking about. And then our next duet is coming from Massachusetts. Anna Gosling is from Blue Cross Blue Shield of Massachusetts, where she's a director of health policy and strategic initiative in the executive office. She manages and coordinates policy and communications. She also manages the development of the company initiatives such as serious illness and palliative care. She's the previous director of policy and research at Blue Cross Blue Shield of Massachusetts. Interestingly, so she has another life as well. She's also a healthcare journalist. So not only can she help design, but she can write about what we're doing. And so she had her experience in the UK and Canada with her journalism. She holds a master's degree in health policy and management from Harvard School of Public Health, a graduate certificate in science writing from the University of California at Santa Cruz, and a bachelor's degree from the University of Toronto. Vicki Jackson is from Massachusetts as well, as I mentioned. She's the Chief Division of Palliative Care and Geriatric Medicine at the Massachusetts General Hospital and Associate Professor, Department of Medicine at Harvard. She's the co-director of the Harvard Medical School Center for Palliative Care. She completed her residency and chief residency in internal medicine at Cambridge Hospital, there at the Harvard Medical School. She was selected in 2003 for a Harvard Academy Education Fellowship. And in 2009, she was selected as the Rabkin Fellow in Medical Education in Beth Israel. And she's the lead investigator and mentor on several research projects that are listed in her bio. She's also a co-author of the book, Living with Cancer. And last but certainly not least is Dr. Gregory James from Fort Lauderdale, Florida. Dr. Gregory James is the Senior Medical Director for Optum Care in the Central Region of the United States. So in that, although he's from Florida, he covers the 6 regional areas, and his responsibility is oversight of clinical and quality for the post-acute and long-term care services under Optum, which he'll tell us a little bit more about. He's been the director of the Family Medicine Residency Program at St. Petersburg, and also the director of the Suncoast Hospital Family Medicine Residency in Largo. He received his Doctor of Osteopathic Medicine as well as his Master's in Public Health from Nova Southeastern University College of Osteopathic Medicine in Fort Lauderdale. So with that, enough of my reading. Let's turn over, and we want to learn to see how it can really be done, how it can be scaled, and then we'll spend some time talking about challenges, what we can learn, and what can be done in our next generation. So with that, I'm going to turn over to our Kaiser team. Thank you.